back. It is 9 minutes after 8 o'clock. Spring is here, and so is allergy season. And with all the warm weather we had this winter, a lot of people are already dealing with those allergies. Lindsay Ritchie is a Minute Clinic nurse practitioner, and she's here this morning to talk about how to prevent those allergies. Good morning, Lindsay.
Good morning.
I know you guys will be coming upon a pretty busy season for allergies.
Yes, ma'am, absolutely. And the thing about it is it's a little early this year. So
yeah,
as we know, we've had a very mild winter. So that means for early spring, as we've seen some of the foliage already, some of the blooms out there.
Yeah. So how do you know the difference between whether you have symptoms for an allergy or actually have a cold?
Right.
What's the difference?
Right. That's a very good question. Usually a cold or a viral type illness.
Yeah.
Symptoms are more severe. Congestion is more present. You can be more tired and also have a fever. Allergies typically, allergies do not cause fever, so so typically that's more your viral cold.
So what are some of the things that you can maybe do to help with seasonal allergies? Is it over-the-counter stuff or other tips?
Well, it just depends. So so if you were in question, you could come into one of our Minute Clinics in the CVS or the Target, and we could talk to you about that. We would review your allergy history, go over some things about the certain time of year when that happens for you. One of the best measures is to start early. So you know, if you have the spring allergies, you actually want to start taking maybe an antihistamine a couple weeks or a week prior to when we were expected to have the allergies in the air. So so that definitely does help instead of trying to play catch up after the symptoms have already began.
Sure. So what can you do to help with seasonal allergies? Should you maybe just not go outside for all of spring?
Well,
you can't do that, right?
You definitely can't do that. But some things are, if you do go outside, you know, take your clothes off, leave your shoes at the door or outside, maybe in your garage, so you're not
bringing it in the house.
Exactly, not bringing it through the house. Maybe limit opening your windows to the fresh air. Just keep your air conditioning on. Make sure your filters are new and clean. Vacuum regularly. If you have children that suffer from allergies, limiting maybe the stuffed animals that are in their bedroom. Just some simple things like that really go a long way.
Sure. And you kind of brought some examples of you know, something you can actually pick up at a CVS that may help with that, right?
Yes. So these things are over the counter. So we have just our allergy antihistamine, which is very helpful for sneezing, runny nose, itchy, watery eyes. And then we have a decongestant here. Decongestants aren't for everyone, so if you're unsure, you could always again seek advice from your medical professional or a nurse practitioner like myself. And then we have some nasal spray. So again, that comes in all forms. We have pill form, we have nasal allergy spray. We even have nasal rinses, which are very, very helpful. So it just, when you're congested and maybe a decongestant doesn't work for you, you could actually use this to alleviate lots of your congestion, rinse away the mucus, and
with the neti pot.
Yes, ma'am.
Yeah. So those are safe to
they
flush
are safe.
you out.
They are completely safe when used appropriately. Yes.
Yeah. So just follow the instructions on that, and you'll be good to go.
Yes,
so and Minute Clinics, are they at every CVS now at this point?
We are at several CVSs.
Okay.
So if there's probably one in your area or on the next block over. So we are also in Target as well. So you can definitely, we're very convenient, easy to find.
Yeah.
You can walk right in without making an appointment, or now you can actually hold your place in line. So if you go online, you can sign up and give you an approximation of your appointment. So just bring in convenient care to a whole other level.
I love the idea of having those. You just walk right in and get help and walk right out. Good stuff.
Yes,
Thank you, Lindsay. Good
information
there. It was really good. We'll be back after this break. You're watching WBTV News This Morning on Bounce.